wisdom teeth. Also known as third molars, we take out approximately 5 million of these in the United States each and every year. Wisdom teeth are a facet of life, and many people are affected by it. And today I'll talk about the impacts of wisdom teeth in everyday life. I'm board certified periodontist, Dr. Jen Kim. I'm also the director of West Coast Study Club, affiliate club of Seattle Study Club in Los Angeles. Wisdom teeth are one of the teeth that we possess in contemporary life that anthropologists considered unnecessary. Once upon a time, we used to eat different types of food, and as modern society evolved, the third molars or the extra teeth became sort of extinct and not really useful, but unfortunately, they still exist in the mouth. So they're commonly impacted or stuck or don't come out sideways, and all kinds of issues are presented. The story today is about Catherine. This young lady has lost a tooth, and in the center of the image, a dental implant was placed elsewhere. She presented with some issues with that implant, but also she presented because she had a sore tooth next to the implant. This tooth, a bicuspid, was actually fractured. So she needed to have a dental implant done. She already has the implant in the blue arrow, but incidentally, she has this wisdom tooth towards the back, and we call them third molars because there's first molar, the implant, the second molar immediately behind it, and the third molar, in this case, way at the back. If you can look at the big picture, the third molar or the wisdom tooth is hidden, tucked back there. It's completely erupted, unlike being impacted where they're stuck somewhere. But unfortunately, this tooth is kind of useless. If you look at the clinical pictures, we can barely pick it up in the pictures because it's so far at the far corner, and there are many consequences. It's hard to reach, it's difficult to clean, and many times they cause infections, cavities, caries, and all kinds of other issues. In this case, if you look very carefully, the tooth has already what we call over-erupted because there's no partner. The lower wisdom tooth was missing, and therefore this tooth simply decided to super-erupt. It's a medical term that we use when the tooth simply grows out of its place and goes into another spot. This tooth was recommended to be extracted. The year was 2017, and Catherine did have the other implant done, but she said, nah, it's not causing any problem, we'll leave it alone, which is perfectly fine until it isn't. Fast forward, I saw this patient this week. This is 2024, 7 years later. Unfortunately, she has humongous cavity that had formed between the second and the third molar. You might say, what's the big deal? Take out the wisdom tooth now. Well, it's a little too late because she has already had cavity in the second molar, and therefore we simply are going to lose another tooth. This could have been prevented 100%. So keeping wisdom teeth, not the most wisest of the decisions. This has been Dr. Jen Kim, the periodontist in Southern California. Do like us and subscribe to our channel. And this is our website for our practice and all of our activities. Thank you for watching.